Good evening, all. So let's start our weekly interaction for the week 4 of our course, Biomechanics, by Professor Bharathan. I am Manjunathan, research scholar from the Department of Applied Mechanics. Let's start today's session. Hope most of the people have hope everybody, most of you have watched our week 4 videos. In week 4 videos, mostly what is being discussed is about the wrist, hand, fingers, and also some portion of spine and neck. This was spine and neck is being discussed in our week 4. So I think we have discussed this in our first session itself. What kind of joint is our wrist joint, which is an ellipsoid joint, and there are 3 other joints. I'm just giving a quick recap so that you can answer the questions easily. Most of these are taken from our videos only, from the professor's videos only. So it will help in refreshing the contents. So you know that 2 bonds join to wrist are radius and ulna. So joints formed in the wrist there are 3 joints, which are radiocarpal joint, which is this one, and ulnocarpal joint and distal radial ulnar joint. So these are the 3 joints which radius and ulna is creating in the wrist. So mostly you can most of you know what is the motions at the wrist. So main movements are flexion and extension, which is uh, folding in this direction is flexion, and folding in the backward direction is extension, and these are radial and ulnar deviations. This is an old diagram, but I hope you can read the uh, parts labeled. So these are the major bonds in the hand. There are mainly 3 classifications, which are carpals, metacarpals, and phalanges. So there are 8 carpal bonds, which is this area. So these tortoise-shaped arrangement of bone, tortoise shell-like of arrangement of bone is called carpals, and these are very irregular bonds, typically vary from person to person. And after that, this carpals is being connected to phalanges, or the bonds of fingers, by 5 other bonds called metacarpals. And phalanges are the bonds that we know as in the hands, or sorry, in the fingers. So there are 3 different portions for a phalange, which is distal, middle, and proximal phalange. So the bone which is joined to the palm is called proximal phalanges, and the middle ones are called, as such, there are 3 portions, and the middle ones are called middle phalange, and the last one, where the tip of fingers are there, is known as distal phalanges. And also each phalange has metacarpus has distinctions like base, shaft, and head. This is for almost all the bones. This classification is there: base, shaft, and head. So the proximal end is known as base, and the trunk of the bone is called shaft, and distal portion is called head. These are joints in hand, palm, and fingers. There are three main joints, which is CMC, MCP, and IP. CMC meaning carpo-metacarpal joint, where carpal bones and metacarpals are joined together. This portion, the joint where carpals and metacarpals are meeting. Then is metacarpal joints, where metacarpals are joining with the phalanges, and interphalangeal joint, that is the joints between the phalanges. So in interphalangeal joint, there are again two classification, uh, where the first or the proximal phalange connects with the distal phalange is called uh, proximal interphalangeal joint, and where the middle and distal is being connected is called distal interphalangeal joint. And these interphalangeal joints are hinge joints, whereas metacarpal joints are ellipsoidal joints. CMC joints have both saddle joint and ellipsoidal joint. This is a anatomy of a human adult, spine of a human adult. In adult spine, there are 33 vertebrae, where first 7 is called cervical vertebrae, which is named as C1 to C7. C for cervical vertebrae from top to bottom is numbered as 1 to 7. Then after cervical, there is a thoracic region. Human adult have a 12 thoracic vertebrae, which is named as T1 to T12, following which 5 lumbar vertebrae, which is L1 to L5, then 5 fused sacral vertebrates, and 4 fused coccygeal vertebrae, which is a tailbone. Whereas these two joints, we have discussed about this in the second week, I think. C1 and C2 has two names, which is C1 is known as atlas and C2 is known as axis. C1 supports the skull and forms the atlanto-occipital joint, whereas C1 and C2 is being connected, joined by atlanto-occipital joint. In last session, we have discussed mostly about this sternocleidomastoid muscles, which is forming the back of the neck and also in the scapula region. So these are the other muscles that help to move our head. So the head is kind of placed on the top and is away from the trunk, so which makes it vulnerable and difficult to move. It's not like that structure. It's like round structure, uh, cantilever structure, and the top portion makes it difficult to handle. So there are multiple group of muscles which is helping in the movement of head. So I hope you have seen this. I am not going here in deep. While doing the questions, we can come later and see which are the different muscle groups here. These are the muscles in the posterior neck and back. So if you are ready, we can go for the questions. I will read out the questions and give some time. Try to answer the question. Don't hesitate to answer. Even if the answer is wrong, it's fine. You will remember for the exams later. Most of the questions are from either from previous year question papers or previous year assignments. So do try to answer the questions. First question is, what type of joint is acromioclavicular joint? I hope we have discussed in last class also this one. So the question is, uh, what is the type of joint is the acromioclavicular joint or the AC joint? Options are synovial ball and socket joint, synovial hinge joint, synovial plane joint, fibrous joint. Yes, option C, that is synovial plane joint. Acromioclavicular joint is formed by clavicle, which is the neck bone, sorry, collarbone, and acromion portion of shoulder bone. So this is the AC joint. So which is the synovial plane joint. Next question. The pectoralis major muscle has how many heads? Last week we have discussed on the same question for biceps brachii. So here the question is on pectoralis major. How many heads does the pectoralis major muscle has? Options are option 1, 2, 3 or 4. Try to answer the question. Pectoralis major is our uh, chest muscle, which is one connecting from it's a the muscles group. This is the pectoralis muscle, so which is connecting sternum, that is the chest bone, with the shoulder components. So this has two heads. Similar to biceps brachii, pectoralis major also has two heads, which is known as uh, the two heads are known as one is sternal head. So it is connecting sternum and clavicle. So it's sternal head and clavicular head. These are the two heads of pectoral nature. Next question. The acromioclavicular joint, AC joint, contributes to which of the following functions of the shoulder? Options are stabilizing the glenohumeral joint. Option B, facilitating upward rotation of the scapula. Option C, enabling elbow flexion and extension. Option D, providing a hinge for wrist motion. The question is, what are the functions of acromioclavicular joint, or which of the following functions are being done by acromioclavicular joint? Options are stabilizing glenohumeral joint, facilitating upward rotation of scapula, enabling elbow flexion and extension, providing hinge for wrist motion. Okay, the answer is option B. I can see some of you have confused with A also. So here, see, this is one joint. This is also another joint. So the basically stabilization of joints are done by muscles, not another joint. So it's like uh, I think last week also we have discussed about uh, supporting muscle groups, and also uh, which muscles help in which motion. So stabilization, also anchoring, all those functions are done by muscles on joint. So here the question is on what is the functions which is done by acromioclavicular joint. So even though these are nearby joints, but uh, this stabilization is done by muscles. Mostly calf muscles are being done by uh, is being sorry is what that stabilizes glenohumeral joint. So function of a joint is in movements. So uh, you can see this stabilization is a function of muscles and tendons. I mean the supporting structures, where movements are the functions of joints. So here if you see the other two are for elbow and wrist, so you can easily cancel out this. And also there is only one motion which comes in the vicinity of acromioclavicular clavicular joint, that is facilitating upward rotation of scapula. Scapula is the wing bone or the bone on the back side of the body, just behind the shoulder. Option B is our answer. Next question. Which of the following joints is not a part of wrist joint complex? So we have seen there are different joints in the uh, portion where these bones are joining carpals. So the question is, which of the following joints are not a part of wrist joint complex? An easy one. Yes, right. Answer is glenohumeral joint, because glenohumeral joint is in the shoulder. So this one is not a part of wrist joint complex, whereas radiocarpal, adenocarpal, and midcarpal joints are in wrist joint complex. Next question. Which type of joint is metacarpophalangeal, that is MCP joint? Options are hinge joint, option B ball and socket joint, option C ellipsoidal joint, option D saddle joint. So what type of joint is metacarpophalangeal, that is MCP joint? Okay, there is also confusion here. Okay, answer is option C, ellipsoidal joint. So the question is metacarpophalangeal, that is the joint where metacarpals joins phalanges. So here what it is not just a hinge joint, but if you see hinge joint meaning you can only move in this direction, that like a book opening and closing. So that kind of joints are called hinge joint. So if you see the joints where your finger starts, you can tilt it sideways also, like saying no to somebody. That lateral motion is also there, not just uh, this book motion or kind of angular motion. Sideways motion also there. So that's why it is classified as ellipsoidal or condyloid joint. So simply saying, this is your pointing finger. Imagine this is your index finger. So you can just move it in the closing and opening direction, that fist making direction, you can fold it. Also, you can move it sideways also. uh, that makes it more, that gives it more degrees of freedom, which is out of the context of hinge joint, makes it a ellipsoidal joint. Hope that clears the confusion. Next question: what is the primary function of opponent's pollicis muscle? Options are extension of the thumb, option B opposition of the thumb to the little finger, option D flexion of the thumb, option D abduction of the thumb. So easy question. From the muscle name itself, the function is understood. Okay, option B is our answer. It is opposition of thumb to the little finger. So the word opponents itself gives it away. From that word itself, you can easily figure out which is the function of opponent's pollicis muscle. And this oppositely placed finger, oppositely placed thumb, is the one virtue by which humans can do a lot of things, which none of the other animals have. Next question: which of the following is true about carpometacarpal, that is CMC joint of the thumb? So the question is on specifically on CMC joint of the thumb. Which of the following is true about CMC joint of the thumb? Options are: it is a hinge joint, it is a ball and socket joint, option C it is a saddle joint, option D it is a plain synovial joint. So if you try to check what all motions are there for your CMC of your thumb, then you can easily figure out, I mean, eliminate the options and get reach the answer. The carpometacarpal joint means where the carpals meets metacarpals. So for a thumb, it is a saddle joint. Option C is the answer. For a thumb, the CMC joint is a saddle joint. Next question: which of the following movements is permitted at the proximal interphalangeal joint, that is the PIP joint? Options are flexion and extension, abduction and adduction, rotation, pronation and supination. Which of the following movements or motions are permitted at the PIP joint, that is the proximal interphalangeal joint? So again, imagine this is your index finger. So this is the proximal phalange, this is the middle phalange, and this is the distal phalange. So proximal interphalangeal joint meaning this point where the proximal phalanges is meeting with the middle phalange. So here, if you move your fingers, you can see there is only what you can make a rest. You can move it like a move it in one direction, one single plane only. So that is flexion and extension. Option A, flexion and extension. Next question. This joint is a type of which of the following? Options are saddle joint, ellipsoidal joint, hinge joint, ball and socket joint. I think we have already discussed this question. You can quickly answer that one. I think it's a repetition. Yes, answer is option B, ellipsoid joint. Next question. Select all the correct statements. So the question itself gives there might be more than one correct statement. Options are option 1. Each each finger including the thumb has 3 phalanges. Next question. Sorry, next option. Thumb has only 2 phalanges, whereas the fingers have 3 phalanges each. Next option. The thumb CMG is a saddle joint. Sorry, not CMG, it's a CMC. The thumb CMC is a saddle joint. Options are each finger including thumb has 3 phalanges. The thumb has only 2 phalanges, whereas the fingers have 3 phalanges each. The thumb CMC is a saddle joint. Option D, all of the above are true. So you can easily eliminate the last one, all of them are true because first two options contradict each other. The answer is option B and C. If you check your 5 fingers from your small finger to index finger, all those 4 fingers has three phalanges each, that is proximal, middle, and distal, whereas thumb has only two phalanges. Also, we have seen in the previous question that thumb CMC is a saddle joint. So, these two are the options, the correct options. Next question. The following muscle is responsible for the opposition movement of thumb. This we have seen in another form in one of our previous question. We were discussing the same concept in a opposite meaning. So here the question is just reversed. The following muscle is responsible for the opposite of movement of the thumb. Name the muscle, which are options are abductor pollicis brevis, flexor digit minimi brevis, opponents pollicis, opponents digiti minimi. Yes, the answer is option C, opponents pollicis. Because in previous question it was discussing about what is the function of opponent pollicis. So from that options it was easy that opposition moment, that opponents and opposition you could easily connect. But uh, the question like similar this one will be more difficult than the other one, because the opposition movement of the thumb here, if you check, there are two opponents are there. Also, if you think in flexion, abduction, flexion and extension manner, then there is on flexor also. So this question can get confusion. So uh, be clear about the functions of the muscles. Answer is opponent pollicis. Next one, major joints of the wrist. This also we have discussed in another fashion. So major joints of wrist are, options are ulnohumeral joint, ulnocarpal joint, radiocarpal joint, distal radial ulnar joint. Yes, true. Answer are option B, C, and D. So it's easy because even though you don't exactly remember the joints, from the name itself you can easily figure it out. These two uh, options as the carpal, where the from itself you can ulna and radial bones joining with the carpals are ulna carpal and radiocarpal, and distal radial ulnar joint. So distal portion of the radial is in the wrist. So whereas this one is humerus. Humerus is the upper arm. Humerus is the bone connecting from the shoulder to elbow. So ulnohumeral is in the elbow joint. So these three options B, C, D are the major joints of wrist. Next question. The human has dash number of carpal bones and dash number of metacarpal bones. So here the question is on numbers of bones. Try to answer the question. The human hand has dash number of carpal bones and dash number of metacarpal bones. Is it 5 and 8 or it is 8 and 5 or 3 and 8 or 9 and 5? Yes, answer B, that is 8 and 5. 8 carpals and 5 metacarpals. And you can easily eliminate this one from the question. And also, if it's fine, you are finding it difficult, you can easily remember like this. This is the hand. So here is the carpal bones, then metacarpals, then phalanges. So it's actually in order. Carpal has 8, this is 5, this is 3. So you can just make an equation. 5 plus 3 is equal to 8. So 3 phalanges from the, if you are counting from the distal point, you have 3 phalanges and there will be 5 metacarpals which will add up to get 8 carpals. So 5 plus 3 is equal to 8. This you can easily remember in either order. You can keep in mind. I mean, memorize this. You can from memorize at 8 carpal, 5 metacarpal, 3 phalanges, or in reverse order. Next question. Atlanto-occipital joint allows for which of the following? Options are flexion and extension movement of the head, axial rotation of the head, lateral flexion and extension of the head. Option D, all of the above. Yes, atlanto-occipital joint is the joint where atlas, which is the first cervical bone, connects with the occipital bone of the skull. So atlanto-occipital joint is the joint where spine is being connected to the skull. So this gives uh, flexion and extension movement of the head. Next question. Intravertebral disc are. So we have vertebral disc and intravertebral disc. So the question is on intravertebral disc. Intravertebral discs are option A, thick in the cervical region and thinnest in the lumbar region. Option B, thin in cervical region and thickest in the lumbar region. Option C, uniform throughout the spine. Option D, thicker in superior regions of spine when compared to inferior regions of spine. Intravertebral discs are the disc which allows the motion or which allows the movement between two vertebral discs. Yes, correct option is option B, thin in the cervical region and thickest in the lumbar region. That is, this is the spine. So this is the top neck portion. So this is the cervical region and followed by thoracic and lumbar. Uh, so in cervical region, the intervertebral discs are thin, uh, uh, which is for the smooth movements between the vertebral disc. Whereas in lumbar region, that is the lower back, it is thickest for the load carry. It to help support the load carry, also to uh, reduce the wear and tear from the increased range of motions. So these are the intravertebral disc at the lumbar region when undergoes wear and tear creates dislocation and other issues for the lower back issues, lower back problems in old age and all. Next question. The dash is considered as the functional unit of the spine. Options are vertebrae, intervertebral discs, nerve, motion segment. The dash is considered as the functional unit of spine. Try to answer the question. Which is considered as the functional unit of spine. No, it's not vertebrae. The question is on functional unit of the spine. It's a unit, functional unit. It is known as vertebral motion unit. Sorry, motion segment. Functional spinal unit. It is also known as functional spinal unit or vertebral motion segment. That is our option D. Is our answer. So, if you wonder what is this motion segment or vertebral motion segment, if you see from sideways, that is in lateral view. Suppose I am just making a crude drawing. This is one vertebrae and this is another vertebrae, and this is the intervertebral disc in between. So this vertebrae, two adjacent vertebrae plus intervertebral disc, that is a disc in between, and plus the facet joint, that's the joint which creates between these two. Facet, FACET, facet joint plus the supporting ligaments. So one single unit for every pair of vertebrae is known as functional spinal unit or vertebral motion segments. So it consists of two adjacent vertebrae, the intervertebral disc, the facet joint, and the supporting ligament. And one other sorry, one other name for this facet joint is zygophysial joint. So this is also a confusing name. You can note it down. Another name for this facet joint is zygapophyseal joint. This is called a functional unit because it it these five components join together to make possible different things. That is the load transmission. Because at the same time, multiple things are being done by this unit. That is the load transmission, flexion, load transmission. This can also come in some as the following or something. Load transition, flexion, extension, lateral bending, axial rotation, and finally stability and mobility. So these single functional unit gives 5 set of functions at the same time. That's why it's known as uh, functional spinal unit or vertebral motion segment. Moving on to next question. Which of the following statements are false? Options are: first one, atlas vertebrae supports the skull. Second one, the vertebral column allows for the movement in all three anatomical planes. Third option, the vertebral column allows for the movement only in two of the three anatomical planes. Fourth option, the vertebral column allows for movement in only one of the three anatomical planes. Fifth one, the atlanto-occipital joint allows for 29 to 30 degrees of flexion extension movement. Which of the following statements are false? The question is, which of the following statements are false? You have to pick the four statements from the five options. Okay, the answers are, the false statement among these are option 3 and 4. That is, the vertebral column allows movement in only two and in only one. That is because the vertebral column allows movement in all three anatomical planes. So when this statement becomes true, the other two becomes wrong. And also, the atlanto-occipital joints allows around 25 to 25 to 30 degrees of flexion extension moment. And also, you know that atlas is the C1 segment and this vertebrae is the one giving support to the skull. So options 1, 4 and 5 are, sorry, 1, 2 and 5 are correct, whereas these two are wrong. And if you wonder which is the three different movements in three different anatomical planes, that is, in sagittal plane there is flexion and extension. in coronal plane, the vertebral column allows lateral flexion. If you have seen the videos, you would remember the sideways movement, lateral flexion, and in transverse plane, that is the axis transverse, it gives you rotation. So the vertebral column allows movements in all the three anatomical planes. Oh, that's understood. Moving on to next question. With regard to the erected spine group of muscle, which of the following is true? Options are: the spinalis group is most medially located, and Leocastalis group is most laterally located. Second option, the spinalis group is most laterally located, and Leocastalis group is most medially located. Third option, the longissimus group is more medially located when compared to spinalis group. Fourth option, the longissimus group is more medially located when compared to Leocastalis group. Try to answer the question. With regard to erected spine group of muscle, which of the following is true? Okay, I think there's a confusion there. This one we have. So these are the erected spiny group. So here you can see there is a Leocastalis group, longissimus group, and spinalis group. Our question was the location of these groups. So first option is the spinalis group is most medially locate and iliocostalus is most laterally located. So spinalis group, if you see the ones in green, that is this here and also this one here. This is the most medially, that is most inward towards the medial plane. So here you can see it's in the inward plane only. And the second part of the first option was the leucostatic group is most laterally located. So this blue ones you can see, this is the most outside ones or sideways laterally located. So the first option is true, that is the spinalis group is most medially located and the leucostalis group is most laterally located. So the second option is just reverse of this, that is the spinalis group is laterally and leucostalis group is medially located. So the second option is wrong. And next, the longissimus, third option is the longissimus group is more medially located when compared to spinalis group. So that's also not true when compared to that. This can have the option is, if you see this, the option is the spinalis is most medial, the longissimus is intermediate, and leocostal is most lateral. So anatomically, if you say both spinalis and uh, spinalis is, spinalis is in the medial, longissimus is in the middle, and leocostalis is in the lateral. So then that makes option C and D wrong. So there is only one answer, which is option 1, that is the spinalis group is most medially located and leocostalis is laterally located. That is a little confusing, but try to remember the order. Next question. The flexion and extension of the shoulder movement happen in which plane? The flexion and extension of the shoulder movement happen in which of the following planes? This we have seen in different, the reverse order also. The options are coronal plane, sagittal plane, transverse plane, and none of the above. The answer is option B, that is a sagittal plane. Moving on to next question. Movements involved in the acromioclavicular joints is, options are rotation of the forearm, elevation of the shoulder, flexion of the shoulder, and pronation of the shoulder. Which of the following movements are involved with acromioclavicular joint? So it's not the flexion of the shoulder, it's the same elevation of the shoulder. Option B is the answer. The movements involved with acromioclavicular joint from the given set of options is option B, elevation of the shoulder. Next question, which of the following statement is or are true? Options are pronation and supination of the elbow occur at the wrist joint. Sorry. Option B, pronation and supination of the elbow occur at the radio-ulnar joint. Options are statement 1 only, statement 2 only. Both statements are true, both statements are false. Yes, option B, that is statement 2 only, that is pronation and supination. Uh, that is a rotation, sideways rotation of the wrist is uh, made possible due to the radio-ulnar joint. This where the bones, the flexing of the relative motion of both radius and ulnar bones makes the twisting motion of wrist. Next question, which are the muscles involved in the flexion of elbow joint? Which are the muscles involved in flexion of elbow joint? Options are first option triceps brachii, biceps brachii, branchioradialis, brachialis. Which are the muscles involved in the flexion of elbow joint? Yes, the answer is these three. That's the muscles that are in the front of the inner portion of the upper hand. That's which are biceps brachii, branchioradialis, and brachialis. And the muscle which help in the extension of elbow joint is triceps brachii. So our options are B, C, and D. These three muscles are involved in the flexion of elbow joint because there are three major major muscle groups involved in the flexion of elbow joint, which just makes the human hand uh, stronger to lift things, or for the greater agility, range of motion for the hands or upper limb. Next question. This we have already seen in one of the questions. Again, try to answer the question. Which of the following statements are true? Each finger has 3 phalanges except thumb has 2 phalanges. So the question is, which of the following statements are true? Options are first statement only, second statement only, both are true, both are false. Okay. Quick easy question we have already discussed. Yes, option C, that is both statements are true. That is each finger has 3 phalanges except for thumb, and thumb has only 2 phalanges. So our answer is option C, which is both the statements are true. Next question. Which joint is involved in the thumb flexion and extension? Options are CMC joint, MCP joint, wrist joint, PIP joint. So the question is, which joint is involved in the thumb flexion and extension? CMC is carpo-metacarpal joint. MCP is metacarpo-phalangeal joint. Next is wrist joint. PIP is proximal interphalangeal joint. Yes, option A, that is CMC joint or the wrist joint. It is where because only thumb only has 2 phalanges, the CMC joint makes the thumb flexion and extension. So our answer is option A, CMC joint or carpo-metacarpal joint. Next question. How many vertebrae are present in adult human vertebral column? Options are 24, 26, 33, 30. option is option C. Right option is option C, that is 33 vertebrae is present in adult human vertebral column. Next question. The normal number of cervical vertebrae are. Options are 5, 7, 8, 12. What is the normal number of cervical vertebrae? Options are 5, 7, 8 and 12. Answer is option B. C1 to C7. That is cervical vertebrae are C1 to C7. There are total 7 cervical vertebrae in adult human. Next question. Which region of the spine bears the maximum body weight? Options are cervical, thoracic, lumbar, sacral. Question is, which region of the spine bears the maximum body weight? Options are cervical, thoracic, lumbar and sacral. Yes, option C, that is lumbar. In the previous question also, I have discussed why lumbar intervertebrate discs are thicker than the cervical ones, because this is the region where the lower back is the region where uh, which supports the maximum body weight, and also the when we lift weights also, this is the region where giving the core support. The answer is option C, lumbar region. Next question. The vertebrae that articulates with the skull is. Options are axis, atlas, C7, T1. The vertebrae that articulates with the skull is which of the following? Axis, atlas, C7, T1. Yes. If you remember, axis is C2, atlas is C1, then C7 is the cervical 7, T1 is the thoracic first. So the vertebrae that connects with the skull is C1, which is the atlas. Our answer is option B, atlas. Next question. The odontoid process, which also called as dance, is a feature of which of the following? The odontoid process or dance is a feature of which of the following? Options are atlas, axis, C7, occipital bone. Answer is option B, axis, which is the C2. This process called odontoid process is the portion which uh, act as a pivot for the rotation of C1 or the atlas. So the odontoid process is also this can also be asked as a question, which is the uh, uh, bone has the pivotal portion for rotation of skull. Next question. The primary kyphotic curvatures are present in the this is a little advanced question, so try. I don't know whether you understand what is kyphotic feet curvature. Uh, Try to answer the question. I will explain. The primary kyphotic curvatures are present in the cervical and present in the which of the following regions? Options are A, cervical and lumbar regions. Next one, lumbar and sacral regions. Cervical and thoracic regions. Thoracic and sacral regions. So, where is the which are the regions where primary kyphotic curvatures are present? The answer is option D, that is thoracic and sacral regions. If anyone is wondering what is kyphotic, it is from kyphosis, that is in layman language most of it called hunchback, that rounded back issues you might have seen that in medical terms or in anatomical terms it is known as kyphosis. There are two major curvatures or deformation that can happen to a spine. One is kyphosis, second is scoliosis. Scoliosis is the lateral curvature. Suppose you are looking at a spine from the back side, that is the posterior side. Then if the spine is going something like this, it's a lateral. Actually, for a normal person, it should go somewhat like this without much deviation, but it is moving to sidewise, any of the side. That kind of twist is known as scoliosis. So the question is on kyphotic curvature. Where is the that hunchback feel or the rounded back feel? Where is the that particular type of curvature present? So answer is thoracic and sacral region.